Bore da, good morning everybody and welcome to this meeting of the board, which has been convened to consider the Health Board's annual report and accounts for 2021 to 22. You will see the attendance list on screen. I'm Vivian Harpwood, Chair of Powys Teaching Health Board, and the attendance of this meeting is as listed in the slide on screen. But I'd like to welcome particularly Gareth Lucy and Alice Rushbury from Audit Wales, who are joining us today. So welcome to them. We have had some apologies and you'll see that those are listed there as well. I think possibly we can add Kathy Poynton to those because I think she's on leave. Are there any declarations of interest, please? No? All right, so we'd like to proceed. I think, Pete, if you'd like to introduce this item, we want to receive the Audit Wales and Audit of Accounts report.
Okay, thank you, Chair. So I'd like to introduce Gareth Lucy from Audit Wales, who's going to take us through the audit report in terms of the accounts for 2021-22. So if I can hand over to Gareth, and he can take us through that, and then later on the agenda we've got the actual financial statements, and I've got a presentation in terms of the detail within them. So thank you, Gareth.
That's great. Thank you, Pete. Good morning, Chair. Good morning, everyone. And just to introduce myself for people who haven't met me yet, my name's Gareth Lucy and I'm the Audit Manager with responsibility for the accounts audit for Powys Health Board this year. With me this morning is Alice Rushbury, our Audit Lead. So this is to present our closing Audit of Accounts report. We don't have a separate presentation as such. I was just intending to talk through the report that's in your pack. So I'll just be referring to the various paragraphs within there as we run through it. And I wasn't proposing to spend too long focusing on every single detail within the report, but really just to head out some of the key headlines for you. And of course, happy to take any questions that anyone may have after that as well. So in terms of the main headlines coming out of our audit this year, the overarching result of our work is summarised right on the contents page at the top on page 3, which is that we're proposing an unqualified, true and fair opinion on the Health Board's accounts, and also a qualified regularity opinion on the Health Board's accounts this year as a result of expenditure on clinicians' pension tax liabilities. So what does this mean in practice? Effectively, we are saying that the figures within the accounts are truly and fairly stated. We have no problems at all with the truth and fairness of the accounts. We find them to be materially accurate representation of what the Health Board has achieved during the year. So from our perspective, no problems on that front. We're happy to certify on that basis. The qualified regularity opinion is quite a technical matter, arising from an all Wales issue and isn't really a reflection on anything that the Powys Health Board has done individually. This just arises from a ministerial direction issued a couple of years ago relating to making good any shortfalls in senior clinicians' pension tax liabilities. And expenditure has been recognised for the first time in the Health Board's accounts this year, as it will be across a number of health boards in Wales as well. So in line with previous substantive reports that the Auditor General has issued, he views this expenditure as material by nature. And as a result, the regularity opinion of the Health Board is qualified as a result for this year. Full details of this are set out from paragraph 9 of the report, so you'll see details there. We've also got our substantive report within Appendix 2 of our closing report as well, which sets out the full wording of our audit certificate this year. So hopefully that'll set out a lot of the context there for you. But I suppose, again, from my perspective, just to reassure you that this is very much an all Wales issue. Any health board with similar expenditure this year will also have similar wording in their audit certificates this year, as well as potentially the Welsh Government too. So this is, very much a wide-ranging point that isn't just local to Powys Health Board. So that's the overarching finding of the audit. In terms of other points to raise from our closing report, you'll note from paragraph 16 of the report, we have a section there for uncorrected misstatements. There's one misstatement that we identified this year in our audit which hasn't been corrected by the Health Board. Again, this is quite a technical matter. It's an all Wales matter again, so similarly any health board in Wales will have similar wording in their audit reports this year. Just relates to a technical matter regarding the indexation of building assets this year. And obviously everyone will be aware of the inflationary impacts that have come in towards the end of 2021-22. That's led to some issues regarding the level of indexation that should be applied and some late notification that came through from the district valuer this year, leading to complications there. It's given rise to a misstatement in the accounts as we classify it. It's not material, doesn't affect our audit opinion, but it's just raised for your information, just given the value that results from there. And then finally, Chair, the only other thing to flag up from our report is the recommendations arising. You'll note there are 3 areas of recommendations arising from our report. So they're set out in the body of the report from paragraph 22 and also in appendix 4 at the back of the report. Not material issues for this year again, but really just areas of focus which we'd like to follow up on with the Health Board for next year, just to try and tighten up on. Just given some of the, it might give rise to risks in future years, but ultimately for this year, no particular concern arising from those. But again, flagged up for the board's information. Other than that, really, Chair, our audit corrections are summarised in Appendix 3, so they're there for information as well. Nothing concerning in terms of the level or number of those corrections arising this year. And really just some closing thoughts from me, Chair, just to say thank you to Pete, to James and their teams as well, in terms of the effort that's gone into producing these accounts this year, which has been very much appreciated, but also the help that they've provided to Alice and the team on our side in terms of allowing us to complete our audit work to what remain quite challenging deadlines, and having to work remotely as well, adds to that complexity. So thanks very much from us to them. But after that, Chair, I'm happy just to take any questions that anyone may have.
Right, thank you. Does anyone have any questions? Bearing in mind this has been to Audit Risk and Assurance Committee yesterday and has been discussed. I'm not sure I can see any questions. Then perhaps hang on.
Chair, could I come back, please?
Yes, of course.
Chair, it's okay.
Oh, yes.
Yeah, just really, thanks very much, Gareth, for going for explaining so clearly. Just wanted to say, firstly, that we've accepted all the recommendations that Audit Wales have made, and we'll work to improve on the learning from this year's process. And I just wanted to come back and echo the thanks back to Gareth and to Alice and the team.
Yes.
It's been an excellent working relationship and worked through the audit really well, so their hard work and their support through the process is much appreciated. So thank you.
Yes. Yes, you've preempted me. Right, Carol, you wanted to come in, I think.
Yeah, thanks very much. And I just reiterate the thanks that Pete's just expressed. If I could just comment on the issue of the qualification of the accounts. It is extremely disappointing, of course, to have a qualification of accounts. Gareth and I and other colleagues have discussed this. I think we've looked at it at every angle, and I've expressed my concern about this. I am satisfied through the work that's been done and the discussion that we've had that there is no other action that the Health Board could have taken in terms of not following a direction that had been issued by government. For people who may be watching this, it may seem very technical, and I understand that. I think the reality relates to a decision that was made by government in light of the pandemic and in light of trying to enable clinicians, particularly senior clinicians, not to get penalised for working additional hours during the pandemic. So that there's a little bit more sort of colour around that for anyone who may be interested in this. Nonetheless, on a regulatory aspect, I do understand the Auditor General's interpretation and an issue with that, but this one does feel outside of our control, and I particularly wanted to get a good understanding of this issue myself in terms of what we could have done differently to have avoided that. However, I am reassured as the accountable officer that the preparation of the accounts has met a good standard as reviewed by our external audit partners. So on other matters other than this, I think that the high standard has been achieved. So I hope you don't mind me just outlining that a little bit more, because we are in some quite unusual territory as a health board to have had our accounts qualified.
Yes, thank you, Carol, for that additional clarification. I think it's important that people realise the context. Well, in that case, again, I would like to thank everybody involved, because I know this is always a detailed and painstaking process at this time of year. Could I ask Mark Taylor then, who in Tony's absence chaired the Audit Risk and Assurance Committee yesterday, to present the recommendation of that committee in relation to the items in section 2.3 of the agenda, which is that they should be approved. There's nothing contentious in the report, and it should be taken as read. Mark?
Thank you, Chair. Yes, I had the pleasure, as you said correctly, of chairing the meeting yesterday, and effectively we considered the suite of documents under consideration, including the audit and the letter of representation, and the committee considered those, discussed them, and effectively recommend to board that those are taken and accepted, and that the process moves forward with the committee's approval. Thank you.
Thank you, Mark. Carol, would you like to come in at this point?
I don't think I have. I don't think I have very much more to add, Chair, to that. I think the accounts are there, and Peter's the Director of Finance has agreed the management actions to take forward, which I endorse. So I don't have any more to add in terms of the accounts themselves.
Okay, thank you. Can we move to the next item then?
Chair, I wonder if in terms of flow, whether we continue with the accounts and then moves on to the other documents. Yes. I don't know if that works better.
Yeah, that's fine. Yes.
Thank you, Chair. Yeah, a good suggestion, James. So what I would do is just take the board through a short presentation, which just takes us through the financial accounts at a high level. So I think Liz has got control of the slides. Thank you, Liz. Could you move on to the first page, please? Okay, so in terms of our key statutory requirements, in terms of our revenue position, we have to deliver a balanced position against our revenue resource limit. We delivered an outturn position of an £80,000 surplus, so we met that target. On saying that, a big congratulations should be given to the whole board, because a lot of action from all budget holders and all members has been crucial in delivering that position. In terms of capital, we've remained within our capital resource limit and delivered a surplus of £67,000. Again, the same comment for all those involved in managing the capital programme. It's been a significant level of expenditure in the previous year for us, and that's a fantastic achievement. We did, however, fall a little short against the administrative target of paying all of our non-NHS suppliers within 30 days, with a target of 95%, and we achieved a level of 87.5%. We understand where our key issues are, and action is being taken to improve that going into the next financial year. If we can move on, please. So this next slide is just demonstrating our revenue financial performance over the last 3 years. So there's also a requirement to deliver a balanced position over a 3-year period on a rolling basis. And as you can see by the table below in the graph, over the 3-year period with the £80,000 underspend in 21-22, we've delivered overall a £278,000 surplus over that 3-year period. Again, that's a fantastic achievement, and if you note, the total spend over that period is just over £1 billion. Thank you. Next slide. Similar sort of statement for our capital position. This demonstrates the performance over the last 3 years, where we've remained within our capital resource limit, and we've delivered an overall surplus of £97,000 over that 3-year period. That's against a total spend of 25.6 million and includes the £67,000 underspend in the last financial year, as previously mentioned. Thank you. And this just gives a bit of analysis of the public sector payment policy target, the 95% of non-HS creditors paid within 30 days, and just gives you a bit of detail on our 87.5%, which feels short. As mentioned, we know that we've got the target area to work on, and we're looking to take action to improve that going into the new financial year. Next slide, please. So now the next few slides will just give you a comparison of our total expenditure against our key service and expenditure areas, comparing 2021 and 21-22. And what you will see is by looking at those bar charts there, you can see that our level of spend is broadly in line with previous years, and that there's a bit more detail as we move through the next slides. The 3 key areas are hospital and community services, healthcare from other providers, and primary healthcare services. So if we can take the next slide. So this first area is our primary healthcare services. As you can see, we've used pie charts here to demonstrate the different areas of spend. I'm not going to go through each one of those areas, as assuming people have had a chance to look at the slides in the pack. But if you look, it clearly shows that the ratio of spend in the relative areas has not shifted dramatically year on year. Just to note that the GMS increase mainly relates to the COVID bonus payment for primary care staff. Thank you. In terms of healthcare from other providers, again, similar sort of picture. You can see from the pie charts comparing the previous year and last year that the ratio of spend is again broadly in line with some small movements. A couple of key things to flag is that there's been a £4 million increase with our non-Welsh providers, with Sath and Wye Valley representing the biggest increase, and we've seen a significant increase in on our continuing healthcare spend, which is related to increased numbers and package costs. Similarly, there's been an increase of £3 million in relation to WISC and ESC in relation to their IMTP. And it's worth highlighting that £2.7 million worth of spend is included in relation to the local authority, and that links to the joint test, trace and protect programme as part of our pandemic response. But broadly back to it, you can see from the pie chart our spend is in a similar ratio. And that theme continues again for our hospital and community spend. Again, I won't go through each category, and people have had a chance to look at that on the slides. But broadly, our expenditure levels have remained consistent in terms of the ratio, even though the amounts would have increased. Just to mention the staff costs, we've had the annual pay award, the additional pension charge, and the additional staffing costs in relation to our COVID response, mainly linked to mass vax, which was a key part of that increase. Thank you. Again, this is a bar chart comparing our income just year on year. Again, broadly in line year on year, fairly consistent. The one that really stands out is the increase in education, training and research income, and that is directly related to Healthcare Research Wales, who we host, and in relation to some of the work they were doing during the pandemic. Thank you. This next one is just giving a highlight of our property, plant and equipment. It's worth noting that there were 2 property purchases during the year, Llanelted Health Centre and some land adjoining Machynlleth Hospital in relation to the capital programme there. It's worth noting that our capital programme added 15.9 million to our asset base during 21-22. And if you look at the table, the second table from the left, you can see how our assets have moved from an opening net book value of 78.4 million to a closing net book value of 93.3 million. So a significant increase, primarily linked to that capital programme of 15.9 million. Thank you. So just really this table giving you the key capital expenditure areas. So Machynlleth being the main area of investment, there's 6.4 million spent in year, and then the second area being around our infrastructure, fire and decarbonisation programme, and a significant investment just under 2 million in terms of digital. Thank you. This next area just to highlight is our movement in provisions. I think that the key one that was going to flag on there was in relation to the scheme pays, and we've discussed that one as part of Gareth's presentation on the accounts. And there's also been a movement in terms of pensions relating to other staff, whereby we were holding a provision for previous organisations before health boards were established, and that now has been discharged in full. Thank you. In terms of our continuing to be a going concern, we had a 3-year IMTP approved in 1920, 21, 22. And our plan was submitted to Welsh Government on the 30th of March 22 for the next 3-year period. We're expecting the outcome of that approval status is slipped a little from the 31st of May, but we're expecting that in the next couple of weeks. We've received the Welsh Government allocation letter highlighting our funding and our revenue resource limit for the year ahead, and there continues to be a requirement for health services provision for the population of Powys. There's also continues to be the joint working and partnership with the local authority, including our joint health and wellbeing strategy. So I'm not going to go through this slide because we've already covered off the regulatory qualified opinion in relation to scheme pay, so I won't go through this again. And that is it for the presentation. The appendices are the full details of the accounts, and they're all included within the body of the paper. So that's a quick overview of our financial performance. The accounts provide all the detail behind that. Hopefully that's helpful for the board and for any of the public watching to understand that at a high level. Happy to take any comments or questions. Thank you.
Are there any questions or comments, please? No, thank you. Carol.
Yeah, thanks, Chair. I just want to thank colleagues for the work that has taken place in terms of trying to manage public money in the most effective and efficient way during what has been a second challenging year in terms of this period that we're reporting now. So we did get significant financial assistance from the Welsh Government in terms of managing COVID, but many of our more routine elements of reporting and work have been disrupted during that period. So to be able to manage effectively the expenditure and to be able to ensure that the governance around that has remained strong and stable is really positive. So I just wanted to thank colleagues for that. Pete hasn't talked much, understandably, about this coming year and the next few years, but the focus on how we utilise the public resource in recovery and renewal is going to be really key. So we are now in a more challenging position in terms of the funding available to us, but we'll come to that in a different arena, Chair.
Thank you very much, Carol. Yes, it has been a very difficult couple of years, and we're all aware of that, and we've got through it as best we can. But I think Powys Teaching Health Board has much to be proud of. So thank you everyone who's been involved in all of the hard work. I propose to deal with the approval of everything at the end, if that's all right with you. So could we continue then, please?
I'm very happy, Chair, to go back to item 3.2.1, I think it is,
Yes.
2.3.1 and 2.3.2. So if I start that off, and just as a preface to this item, to say that in July of this year, we will be holding our annual general meeting. That's the plan at this stage, where these, pretty substantial reports will be translated into what we hope to be more easily accessible information and presentations for the public, for our staff and for our stakeholders. So recognising that the papers that have been distributed are pretty dense at this stage. So I think we can probably take down the slide that says the finance accounts appendices now, but I was just going to draw the board's attention to a couple of key things in the performance report first of all, and then invite any other executive colleagues to make any comments that they wish to. I'm noting that the draft of this report has been through the Delivery and Performance Committee of the board and received that scrutiny and input. However, it is to note, Pete had just talked about the integrated medium-term plan, which we'd submitted, but when for this period going forward, but the period under review here as part of the performance and annual accountability report relates to the last financial year, during which we had an annual report in place. The annual plan in place, I should say. The annual plan focused on three key things. The first one was the response to the ongoing pandemic, and Peter just mentioned the Test, Trace, Protect service that had been established very rapidly and in good partnership with Powys County Council, and obviously the mass vaccination programme, which has been highly successful here in Powys, that we created with multiple partners. So I just want to draw attention to the performance report that says both those services were established from scratch basically, and both have been highly effective, and to congratulate and thank colleagues for that. Both are now moving into different stages of development and at least part reduction in terms of the TTP service as we go forward. The second part of the annual plan last year related to essential healthcare, and that was about really trying to provide as much healthcare as we possibly could to the population whilst being still disrupted by waves of the pandemic. And we will see that in this year, in a most recent performance report, we are now meeting the standard as a provider of health services in relation to the 26-week target. We're very proud of that and the efforts that staff have put in to achieve that. However, there is still significant challenge in relation to the delay of our patients, our residents across Powys in accessing care, particularly from commissioned services. Nonetheless, I will point to the resilience of our services in providing the support to patients and their families during the period of the report, even though we had to do that in a different way. And then the third element was establishing recovery and renewal. That part of the plan has grown over recent months in terms of its momentum, and particularly in relation to the direction that Welsh Government has now published in terms of planned care recovery and the urgent and emergency 6 goals. So that alongside other elements is also highlighted in the performance report. And as I say, there's a huge amount in the performance report that we will attempt to try to get across in informing and engaging people in their local health service when we hold our AGM in July. But Chair, I thought I would just give that little overview there of the key issues of performance. Happy to see if any of my exec colleagues want to add anything in, and then take any questions, Chair, on that.
Okay. Any questions or comments, please? Okay, thank you. Thank you, Carol. And again, just to echo. Yeah,
sorry, Chair. I think Steve would like to come in.
Yes, I can see. Thank you.
Yes, thank you, Chair. And really, I mean, within the report, I'd like to draw people's attention to page 16 of 201 pack around the highlights of the year, because whilst COVID has dominated the airwaves and the delivery of NHS services, the Health Board has achieved a lot of other non-COVID related outputs, which are captured in, as I say, the highlights of the year section of the report that stands the organisation and the public at large going forward. Thank you.
Yes, thank you, Stephen. And it is an achievement, a real achievement during COVID, during that difficult period. Well, again, I thank you, everyone. And could we move to the next agenda item, because I'll deal with all of these recommendations at the end. So
happy to make a start on this, and I will draw James in, recognising James joined us in the final quarter of this reporting period, but I know James and his team have overseen the drafting of the accountability report. Yes. And for those who may feel it's extremely long, there is a guide by which we must follow on these things. So just to give that sense there. I was pleased yesterday at the audit committee that we again had colleagues from internal audit as well as our external audit colleagues contributing to the mechanisms of assurance in relation to the conduct and the controls that we have in the organisation. So I do just want to make reference to the internal audit team who and the head of internal audit opinion is reasonable assurance for us. So to thank colleagues for that work, as well as external audit, so Audit Wales, in relation to both obviously their accounts that they've presented today, but the performance audit work that has continued throughout the year, and in particularly the importance of the structured assessment reports that we draw in. In terms of other regulators, clearly the Patient Experience, Quality and Safety Committee engages regularly in Healthcare Inspectorate Wales reviews and reports of quality, and I do just want to pay particular attention to that in terms of whilst we have been obviously focusing on financial governance, that quality governance plays a really key role in the overall accountability as accountable officer, but also as a board. Within the pack, you will see detail on the makeup of the board and the remuneration report, which is an important document in terms of openness and transparency around how we operate and how public money is invested in leadership of public services such as the NHS as well. And Chair, just from finally from my point of view, I am satisfied that even despite the pandemic, earlier comments that I made, despite the pandemic and the challenge of managing in what has been a public health emergency, we have maintained good governance throughout the period, and therefore I am assured that we have systems of control in place. But if I could hand over to James for comments that James would like to make.
Thank you.
Thank you, Carol. Thank you, Chair. Not a great deal to add. I mean, I think coming in the last quarter and looking back over the full year was a really valuable experience for me in my role to make sure that I can be assured of the fundamentals of governance being in place throughout the year and going forward, and hopefully the board can look at this document and take assurance with regard to making sure that we do have those good governance principles in place, and we hold ourselves to a high standard. I just want to really shamelessly thank my team for all of their efforts with regard to pulling this together, because it's the first time that they've done this. So a big thank you to them and the wider organisation in terms of their contribution. It was looked at by audit a couple of times and by Welsh Government through the normal process, and the relatively minor comments on the draft. So a big thank you to everybody for that. That's all I wanted to say.
Thank you, James. And I'd like to pay tribute to James for coming in and rescuing us. Not that we needed rescuing, but supporting us as a board at such a difficult time. We're very, very grateful to you for your support. Thank you. Are there any questions or comments? Okay, thank you. So I think that will bring us to the final, the letter of representation.
Yeah, so thank you, Chair. The final letter of representation is here for approval,
Yes.
but then be signed off on behalf of the board by yourself and Carol as Chief Exec. So it highlights the issue that Gareth flagged within there in relation to the indexation. There's confirmation that the controls and procedure have in place.
Thank you. So that just brings us to just about to the end of the meeting, and I'd like to deal with what we've been recommended to do by the Audit, Risk and Assurance Committee. The recommendation is that the board first of all approves the annual report and accounts for 2021 to 22, which includes the performance report, the annual accountability report and the financial statements. Are you all happy to approve? Thank you. That the board approves the letter of representation. Everyone happy? And authorises the Chair, the Chief Executive and Director of Finance and IT to sign them where required. Everyone content? Thank you very much. So there are no further items for discussion. As far as I know, there is no other urgent business. I've not been informed of anybody. And with that, we can close the meeting. Thank you all for your attendance today. The date of the next meeting of the board is the 27th of July. Thank you, everyone.
Thank you.
Yeah.